focusing on the innovation and technology in the pre-hospital care in India. So you all know that ambulances and the pre-hospital care has been since 1999 when SEMI was started. We did not have much pre-hospital care happening all over India. First of all, it all started with the Apollo pre-hospital care of 1066, and then after Abdul Kalam and many other pioneers developed the system of 108, which is present all over India. So till today, 108 has a central call center, and the call center activates the driver based on the emergency calls what they receive. Apart from that, this is from the government sector, but otherwise, other private hospitals have their own ambulance systems, starting from Apollo and other private hospitals. Every hospital has a base call center where they receive from a toll-free number or from a fancy number which they have for emergencies. And the person receives the call and about the emergency and then directs it to the emergency department. And from the emergency department, the paramedic receives the call, and based on the triage system of what type of emergency it is, they pick up the BLS or the ACLS ambulance, which is placed at their center. And the ambulance is moved according to the emergency situation. So almost all emergency departments work on this system only. So today in my topic, what better can be innovated in emergency care, that is pre-hospital emergency care, and how artificial intelligence can be introduced or induced into the pre-hospital system. So as you can see, it is defined as an innovation, adoption, and diffusion. In healthcare, it may be a novel idea, but that has clear benefits when compared to what is currently done. The two key qualities of successful innovation should be that they are both usable and desirable. Next slide, please. So there is first I would like to describe about the telemedicine, which is already existent in many parts of India. So if you can zoom this slide, you will be better able to understand this. So how does the telemedicine work actually? As I told you, they receive a call, and once the ambulance center receives the call, they note the chief complaints, and with the help of a doctor or an advanced paramedic, they activate the ambulance. This is about the pre-hospital ambulance care. But using telemedicine, there are a lot of very peripheral rural centers which lack proper emergency care. So our government already has taken an initiative of TIE. Everybody will be knowing in Tamil Nadu, there is an initiative called Trauma Accident Emergency Initiative, where the government of Tamil Nadu has induced trauma training and emergency training to all emergency centers. And they have a central network which automatically or periodically feeds training into the centers. And by fixing the appointments and then by diagnosing and treating through monitoring and through the critical care unit help, mobile clinics or mobile hospitals or mobile emergency care centers provided by the government of Tamil Nadu. Unnai Thedi Maruthuvam or Nammai Thedi Maruthuvam, that is the concept which is happening right now in Tamil Nadu, where the ambulance units or a portable hospital is reaching the village directly. Earlier, it was done by Shankara Netralaya, a very big organization for eye. They were conducting camps and cataract surgeries through mobile units. So by utilizing these technologies and mobile apps, the telemedicine is putting medical care literally at the patient's fingertips, saving both the patients and the healthcare providers. The time and the cost of the treatment is completely reduced. So next slide, please. So as Dr. Sandeep was telling you, this is about the 5G smart ambulance. So this is going to be the future. Almost all hospitals will be getting this. The 5G ambulance is as such. Where the patient has an individual the ambulance has a 5G industrial router where perfect 5G internet or 5G accessibility is there. And you have advanced equipments, like advanced diagnostic tools and remote monitoring of the patient. So right now in Madurai, in Meenakshi Mission, Madurai, there is a tele-robo placed in an ambulance, which is very famous here, where the ECG, which is monitored, when the patient's ECG is running in the monitor, it is transported via 5G to the doctor's screen in the emergency department. And there is a panoramic camera which monitors whatever is happening inside the ambulance to the emergency department. And medical staff wearing the AR artificial intelligence glasses, where they'll be able to see the findings, whether the patient is having bradycardia or tachycardia, and directly it will be live streaming to the department. And there is also, as you see, an ultrasound machine which carries real-time images, which is transferred to the radiology unit of the hospital. So together they'll be able to access a whole screen like a war room inside the emergency room. The future of emergency rooms will be like the 5G ambulances will be directly connected to the VR room of the emergency room, where all teams can access and take a unified decision of how to treat in the ambulance, whether if it is a long distance travel and there is no other option of emergency care nearby. These smart ambulances are going to be installed in everywhere, and Apollo actually has taken this initiative of installing the 5G ambulances. Next slide, please. So drones and emergency response. So abroad in US and UK, you would have heard many food delivery apps like Uber Eats and other delivery apps right now are taking the lead of delivering food through drones. And there are places in Sweden where the medicines are being supplied by drones. So these drones also reach remote locations, providing essential care through before the traditional ambulance arrive. So in India and in Tamil Nadu, there are many hospitals which have started bike ambulance services also. The bike ambulance with the paramedic reaches the emergency site. And in India, you know that a lot of streets are very crowded. So the bike reaches before the ambulance reaches. And they can aid in the collection of environmental and geographic data that can inform healthcare decisions. Next slide, please. And wearable device and sensors. So there are a lot of artificial intelligence devices and which are being introduced in the market. There are many companies. Even one of Mehta Hospital has a separate AI and the wearable device companies which provide real-time data of patients for remote monitoring. Actually, this is a lot of home healthcare coming up in geriatrics. So these devices provide the real-time data of the patient's temperature, patient's heart rate, the BP, the patient's movement, and these real-time cameras actually monitor the patient's every minute movement and whether there is any susceptibility for the patient to fall or have a fall. So these wearable devices sensors, they are monitoring the vital signs, and they have smart watches or armbands that allows for continuous tracking of patients and aiding in the early detection of agencies. And there is biosensors integrated into the clothing also, which monitors vital signs of the disaster victims before they reach the medical personnel. Next slide, please. So AR, this is very actually important because augmented reality, where it is used for training of our emergency medical professionals. There are a lot of virtual classrooms and virtual situations where there is a lot of simulation. If anybody has gone through Dr. Rajadurai, who's already in the audience, he has already spoke more about artificial intelligence and AR, how the future of emergency medicine is going to be. So all these AR applications help the emergency response simulate complex scenarios, like how we simulate a cardiac arrest or a ACLS scenario to improve their skills. So more of these AI and AR enabled skill labs are going to be the future, and it predicts the decision in high pressure situations. Next slide, please. An AI-powered triage system, I want to give a special emphasis to this, that whichever of these lists is going to come or not, but definitely this artificial intelligence induced, that is powered triage system will definitely come into play in major cities, in busy emergency departments like CMC of Kilpauk Medical College or Madras Medical College, or there are so many busy emergency departments which have even a per day census of more than 100 to 150. So these AI powered triage systems, what do? Is they calculate, there is a triage nurse and she records the BP, heart rate, and she enters into a software, and automatically the triage will be done, or directly from the machine which is placed at the entrance, it is directly entered, and red, yellow, green and black is all automatically, and the patient enters into the particular triage. So this will not be a dream, and it should be a reality in the future, in the near future. So to analyze the symptoms and prioritize the cases, and it can also assist paramedics, that is who are coming in the ambulance. Definitely, the AI will be able to give a more smart triage. See, when we receive a patient in the emergency department, a red triage can become a yellow triage can become a red triage. So more human systems or human integrated artificial intelligence should be there in triage system is my call on it. And next slide, please. An automated external defibrillator. Already we are having the systems introduced by the American Heart Association in most of the emergency departments. For example, in Mayo's clinic, we have this automated external defibrillator where the aid is connected to the internet, and then it can transmit data in the real time, providing emergency services with the crucial information. So the code blue and the cardiac arrest, they call it that the Met call. So these cardiac arrests or artificial intelligence induced AED, they are present in every ward there. So they immediately catch the rhythm, and automatically shock is delivered even before the doctors arrive to the scene. And next is the blockchain for medical records. That is, it is used for securely storing and sharing patient information. Already, we have almost all the private hospitals have an individual hospital information system, or a monitoring system, or a patient data storage system. So this is going to be in a blockchain methodology, where there is enhanced communication between the pre-hospital and hospital care providers. So what do I mean by that is, before we go for a pickup for the patient, for example, it is Raju, and he's a 70-year-old male, and we are going to pick him up, and the patient is already a known patient of the hospital. So immediately when you type the patient's name and from which address they are going to come, automatically the AI senses the patient's records, and in the ambulance you'll be knowing why the patient is calling you and when the patient is going to have a heart attack. There are going to be smart mechanisms which say that the master health checkup of every hospital will be able to predict when the patient will be having heart attack in the near future. So the US is working on such a system that the preventive health checkup will be able to clearly and precisely tell you the patient when they will be having a heart attack, or when they are going to develop diabetes, or when they are going to develop hypertension. It is like predicting, and it is real time. Next slide, please. So simulation training, the VR training is the digital simulation of lifelike scenarios for the training purposes, enhancing emergency response training by immersing the healthcare professionals in realistic scenarios and improving the preparedness like multi-casualty. So this is more of a disaster-like scenario. Like we have a lot of disaster drills happening all over for NABH in every hospital. We have also, SEMI has also been part of various disaster drills happening in the airport, in Chennai airport, and in Kerala, we have seen a lot of disaster drills. So these type of simulation training using virtual reality will make our students or paramedics more trained for real-time scenarios when there is a disaster happening at your city. And community engagement planning. So more utilizing the social media and community-driven apps to educate the public on basic first aid. So this time in this MCON, we are planning actually to run a community engagement platform earlier before the MCON arises, to have training of CPR in almost all the prominent cities of India using AI and community engagement platforms. We will be explaining more on that. So I conclude by saying that a vibrant healthcare startup community and the culture of innovation offers the potential to revolutionize future patient care. We need to nurture the movement very carefully and work hard to address the issues of regulation, intellectual property funding, scalability, and procurement. With appropriate focus, a culture of innovation will definitely help in delivering a world-class universal healthcare to the population. So not in the near future, but definitely we all are going to face and experience artificial intelligence, and in the pre-hospital scenario and in the in-hospital scenario. So we should definitely embrace innovation and definitely move forward with artificial intelligence side by side, advancing emergency care.